Have you ever felt that frustrating moment when your joints ache and you're not sure what to reach for first, the heating pad or the ice pack? One of my patients once told me she kept both on her kitchen counter because she switched back and forth every day, hoping one of them would finally bring relief. And I want you to imagine this for a moment. Picture yourself waking up with stiff knees or swollen hands, and instead of guessing what to do, you know exactly which method brings the fastest, safest relief. For millions of Americans over 55, joint pain is a daily companion. Yet so many people remain confused about whether heat or cold is the right choice. I've seen seniors struggle for years, relying on pain medication that masks symptoms, but never truly addresses what's happening inside the body. The real root causes often hide beneath the surface. Things like inflammation, muscle tightness, swelling, or weak supportive muscles. Here's the surprising truth most people never hear. When used correctly, heat and cold therapy can relieve joint pain faster and more safely than medication for many conditions. The science behind it is simple. Heat relaxes tight muscles, improves blood flow, and eases stiffness. Cold reduces swelling, numbs sharp pain, and slows inflammation. But the key is knowing when your body needs warmth and when it needs cooling. Many common mistakes keep seniors in pain far longer than necessary. Using heat on a swollen joint can make inflammation worse. Using ice on a stiff joint can tighten the muscles even more. And relying on just one method over and over again often leads to frustration rather than relief. After decades of clinical experience, I've seen countless seniors accidentally worsen their symptoms simply because no one ever explained temperature therapy in a clear, practical way. I've also witnessed incredible transformations when they finally learned how to listen to their bodies and choose the right form of comfort. Your body is not failing you. It is communicating with you. And when you understand what it needs, you regain control. In this video, I'm going to guide you through the real truth about heat and cold, backed by simple science and real experience, so you can relieve joint pain naturally and confidently. If you find this helpful, make sure to subscribe to Senior Health Daily so you never miss the guidance your body deserves. How joint pain really works. To truly understand how heat and cold therapy can transform joint pain, we first need to look inside the joint itself and understand what is actually happening beneath the surface. Most people think joint pain starts in the bones, but the real story involves the tissues around them. Cartilage cushions the bones, synovial fluid keeps everything lubricated, tendons move the joint, and ligaments provide stability. When even one of these elements is stressed or irritated, pain begins to appear, often slowly and quietly at first. As we age, several natural shifts take place inside these structures. Cartilage begins to lose moisture, which makes it less smooth and more vulnerable to friction. Synovial fluid becomes thinner, so the joint doesn't glide as easily as it once did. Muscles surrounding the joints often weaken from years of decreased activity, causing the joints to absorb more pressure than they were designed to handle. Circulation also slows down with age, meaning joints receive fewer nutrients and recover more slowly, especially after long periods of sitting or inactivity. These age-related changes don't happen overnight, but together, they create an environment where pain develops more easily. One of the biggest culprits behind joint pain is inflammation. I often describe inflammation as a fire that starts slowly, sometimes without a spark you can easily identify. Once pain begins, people tend to move less, thinking rest will help. But less movement causes stiffness. The stiffness creates more friction inside the joint, and that friction fuels even more inflammation. Before long, the inflammation cycle strengthens itself and becomes part of daily life. Many older adults fall into this cycle without realizing it is happening. There are also different types of pain that seniors often confuse. Inflammation pain usually feels warm, throbbing, or tender. Stiffness pain is tight and heavy, especially in the morning. Swelling pain feels puffy, uncomfortable, or stretched. Each type of pain requires a different treatment, yet most people treat all three the same way, hoping for a miracle. This is one of the reasons so many seniors stay in pain longer than they need to. From my experience in the clinic, The biggest mistake I see is misinterpretation. Seniors often misread their body's signals, and as a result, they use the wrong therapy at the wrong time. They put heat on a swollen knee or ice on a stiff back, and when the pain doesn't improve, they blame aging instead of the method. Understanding the true nature of joint pain is the foundation for choosing the right form of comfort. Now that we've explored what's happening inside your joints, let's look at how heat therapy works and why it can be a powerful tool when used correctly. Heat therapy. What it actually does. Now that you understand what happens inside your joints, let's look at one of the most commonly used tools for relief. Heat therapy. Many seniors reach for a heating pad instinctively, often because warmth feels comforting. But very few people truly understand what heat is doing inside the body and why it works so well in certain situations while making things worse in others. Heat is powerful because it encourages the body to loosen and open. When you apply warmth to a stiff or tight area, blood vessels expand and circulation increases. This brings oxygen and nutrients into the tissues while helping waste products and inflammatory chemicals move out more efficiently. With better blood flow, muscles soften, connective tissues relax, and joints regain some of their natural glide. That's why heat often feels like a gentle sigh of relief spreading through the area. For many older adults, mornings are the hardest part of the day. The back feels locked, the knees don't want to bend, and everything seems heavier than it did the night before. This morning stiffness is exactly the kind of pain heat therapy is designed for. It helps wake the joints up, restores fluidity, and prepares the body to move again. Chronic arthritis, lingering tight muscles, or old injuries that flare up with cold weather also respond beautifully to heat because the tissues surrounding the joints often become tight, guarded, or dehydrated. But here's where many people stumble. Heat is not appropriate for every kind of joint pain. If the area is swollen, puffy, warm to the touch, or visibly inflamed, heat can actually make the problem worse. That's because swelling is already a sign of increased fluid in the tissues. Adding heat can expand the blood vessels even more, pulling additional fluid into an area that's trying to calm down. This can increase pressure, worsen throbbing, and prolong recovery. I once had a patient who applied heat every night to her swollen knee because she loved how soothing it felt. The warmth relaxed her muscles temporarily, so she assumed she was doing the right thing. But the next morning, her knee looked even more swollen and tight. When we switched her to cold therapy during flare-ups and saved heat for non-swollen days, her progress was remarkable. It wasn't that heat was bad. It was simply the wrong tool for the wrong symptom. There are several ways to use heat effectively. A warm towel, a heating pad on low, a warm shower, or moist heat packs can all bring comfort. Moist heat penetrates deeper and often works faster for seniors. The key is to apply heat gently, consistently, and with awareness of what your body is telling you. Now that you understand the true role of heat therapy, let's explore its partner, cold therapy, which serves an entirely different purpose and is often misunderstood just as much. Cold therapy. What it really does. As comforting as heat can be, cold therapy plays an equally important role, especially when inflammation is the driving force behind your pain. But unlike heat, cold often feels unpleasant at first. It's sharp, icy, and a little shocking. Because of that, many seniors avoid it without realizing that cold therapy might be exactly what their joints are asking for. Cold works by calming things down. When you place something cold on a swollen or inflamed area, the blood vessels narrow, slowing the rush of fluid that contributes to swelling. This reduction in blood flow decreases pressure around the joint, which is why the area often feels less puffy and less painful afterward. Cold also numbs nerve activity, meaning the pain signals traveling to your brain quiet down for a while. For someone battling swollen joints, this numbing effect can feel like a moment of peace after hours or days of discomfort. Many older adults experience flare-ups after long walks, housework, or even changes in weather. The joint may feel warm, tender, or visibly larger on one side. This is when cold therapy becomes your best friend. A gel ice pack, a cold compress, or even a bag of frozen vegetables wrapped in a towel can help reduce the swelling quickly. It's especially helpful for fresh injuries, where the tissues around the joint become irritated fast. Cold slows down the body's overreaction and helps prevent long-term inflammation from setting in. But just like heat, cold therapy can be misused. Cold should not be applied to chronic stiffness or tight muscles, because the lack of warmth can make the tissues contract even more. Imagine waking up with a stiff lower back and placing an ice pack on it. Instead of relaxing, the muscles pull tighter, making movement even more difficult. Many seniors unknowingly make this mistake, leading to mornings that feel worse instead of better. I remember a gentleman in his 70s who came to see me with swelling in both knees. For years, he used heat because it felt soothing, and he avoided cold because he hated the initial sting. But the more he used heat, the more swollen his knees became. Once we switched him to ice during flare-ups and used heat only before gentle stretching, the change was extraordinary. His swelling decreased, his pain lessened, and his mobility improved more in 3 weeks than in the previous 3 years. There are many forms of cold therapy, from simple ice packs to gel packs that mold around the joint. Cold compresses work best when applied for short periods, giving the tissues time to respond without overcooling them. The key is understanding that cold is not meant to warm or loosen anything. It is meant to calm, quiet, and reduce. Now that we've clarified how heat and cold each serve very different purposes, let's bring these ideas together and uncover the real truth about how to choose between them with confidence. Heat versus cold, the real truth. Now that we've explored what heat and cold each do on their own, it's time to bring the pieces together. This is the moment so many seniors finally experience clarity, because the truth is much simpler than it seems. The real power lies not in choosing one method over the other, but in understanding what your joint is trying to tell you. Your body communicates through sensations, and when you learn, interpret those signals, you begin to choose the right form of relief instinctively. Heat should be your go-to when your joints feel stiff, heavy, or tight. That kind of discomfort usually means the tissues around the joint need warmth to soften and circulate. Heat prepares the joint for movement. It helps you loosen up in the morning or relax after long periods of sitting. When stiffness makes you dread standing up from a chair or walking down the stairs, heat is often the key that unlocks mobility again. Cold, on the other hand, belongs in moments when your joints feel swollen, puffy, or unusually warm to the touch. Swelling is one of the clearest signals of inflammation. In these moments, your joint does not need more heat. It needs calm. It needs the sense of relief that comes from reducing pressure and numbing irritation. Cold slows the body's inflammatory response, giving the joint space to recover rather than inflame further. One of the biggest mistakes I see, even among well-meaning people, is using heat when swelling is present. Heat widens blood vessels, drawing more fluid to the area, which makes swelling worse. Another common mistake is using cold on joints that are merely stiff. Cold tightens the tissues even more, leaving the joint feeling locked and rigid. A simple rule I often share with my patients has changed the way they care for their joints. Use heat when the joint feels stiff. Use cold when the joint feels puffy. This single sentence has helped countless older adults finally understand the difference. It sounds simple, but it grows powerful when you apply it at the right moment. In many cases, science supports this intuitive approach. Studies show that heat increases blood flow up to several centimeters into the soft tissues, improving flexibility. Cold reduces swelling by constricting blood vessels and slowing inflammatory chemicals that accumulate around irritated tissues. These reactions are natural and predictable, which means your choice between heat and cold can have a measurable effect on your comfort and recovery. It's also important to remember that pain without swelling often benefits from heat, while pain that comes with visible inflammation responds far better to cold. Once seniors understand this distinction, their pain becomes easier to manage and less frightening. They stop guessing. They start responding. And when you match the right therapy to the right symptom, something remarkable happens. Relief comes quicker. Swelling eases sooner. mobility begins to return. Instead of fighting against your body, you begin to work with it. Now that we've uncovered the real truth behind when to use heat and when to use cold, let's explore the everyday habits that influence how effective these therapies can be. Daily habits that affect heat versus cold effectiveness. Now that you understand how heat and cold truly work, there's another layer to this story that most people overlook. Even when seniors use heat or cold correctly, their everyday habits can either support the healing process or quietly undo the benefits. I've seen this time and time again. Someone applies a cold compress perfectly after a flare-up, yet the swelling returns later that day. Another person uses heat the right way in the morning, but still feels stiff by afternoon. The missing link isn't the therapy, it's the lifestyle around it. Hydration is one of the simplest yet most powerful factors. Your joints need fluid to move comfortably. Synovial fluid, the natural lubricant inside the joint, becomes thicker and less effective when the body is even slightly dehydrated. Many older adults drink far less water than their joints actually need. When the body dries out, cartilage loses its smoothness, movement feels heavy, and both heat and cold become less effective. Something as simple as drinking water regularly throughout the day can make temperature therapy work faster and last longer. Movement is equally important. Joints thrive on gentle motion because movement helps circulate nutrients and oxygen. When someone applies heat to loosen stiff joints, but then sits for hours afterward, that warmth cannot do its job fully. The joint doesn't get the chance to glide and rehydrate. Even a few minutes of slow walking or gentle stretching after heat therapy can take the relief to another level. The body is designed for motion, and temperature therapy is simply a tool that supports that design. Nutrition plays a powerful role as well. An anti-inflammatory diet creates an internal environment where both heat and cold therapies work more effectively. Foods rich in omega-3s, antioxidants, berries, turmeric, leafy greens, and healthy fats calm inflammation from the inside out. When inflammation is lower, cold therapy becomes more efficient, and heat therapy helps tissues relax instead of fighting an internal fire. On the other hand, processed sugar, fried foods, excessive salt, and refined carbs can undo hours of progress by triggering inflammatory flare-ups. Sleep is another habit that shapes joint health more than most people realize. Poor sleep raises cortisol levels, a stress hormone that increases inflammation. When the body is already tense and inflamed, both heat and cold therapy have to work harder to bring relief. Many seniors tell me they feel stiffest after a bad night's sleep, and it's true. Muscles tighten, joints swell, and recovery slows down. Creating a calm, consistent sleep routine supports every form of joint care. Posture may be one of the most underrated lifestyle factors of all. Slouched shoulders, bent backs, and uneven weight distribution place constant stress on joints. Even if you're using heat and cold appropriately, poor posture keeps the joints strained. Adjusting your posture while sitting, standing, or walking can make relief last longer and reduce the need for constant temperature therapy. And finally, we cannot ignore weight. Even a few extra pounds place significant stress on the knees. For every pound gained, the knees experience up to 4 pounds of additional pressure. When that pressure is reduced, both heat and cold therapy work more effectively because the joint is not fighting against constant overload. Temperature therapy is powerful, but it doesn't work in isolation. It works best when paired with daily habits that support healing. When you combine heat, cold, hydration, movement, good nutrition, restful sleep, mindful posture, and a healthier body weight, your joints begin to transform in ways that feel almost miraculous. Now let's bring all of this to life with real stories from seniors who reclaimed their mobility and confidence by learning to use these methods correctly. Real-world patient transformations. Whenever I talk about heat and cold therapy, I always think of the many faces and stories that have stayed with me over the years. These are people just like you, people who struggled, who felt frustrated, who doubted whether their pain would ever ease, yet found relief not from complicated treatments, but from finally understanding what their joints were asking for. Healing often begins the moment clarity arrives. One of my patients was a woman in her early 70s who had lived with swollen knees for almost a decade. She believed she simply had bad knees and that nothing could be done unless she had surgery. Every evening, she placed a heating pad on her knees because the warmth felt soothing, but her swelling never improved. When she came to see me, she could barely climb the steps into my office. I explained that her body wasn't resisting treatment. She was just using the wrong tool. We switched her to cold therapy during flare-ups, combined with light walking once the swelling eased. Within 3 weeks, she returned with noticeably smaller knees, and for the first time in years, she told me she felt hopeful. Her pain hadn't disappeared, but her relationship with her body had changed. Then there was an older gentleman with a stiff, aching lower back that made every morning a battle. He tried everything from medication to special pillows, but nothing lasted. When I asked him what he used for relief, he said, "Ice, always ice. It makes me feel tough." I smiled, because the very thing he thought was helping was actually making his stiffness worse. His muscles were tight, not swollen. Cold was locking them up even more. We replaced his ice with gentle heat before movement, followed by slow stretching. It was as if a door inside his body finally opened. Within a month, he was standing straighter than he had in years. One of my favorite stories involves a man in his late 70s who walked into my clinic with a cane, convinced he needed injections. His knees weren't swollen. They were simply stiff and burdened by weak surrounding muscles. We used heat before exercise, cold after long walks, and light strengthening between sessions. 6 months later, he returned, smiling like a child showing off a trophy, because he no longer needed the cane. He said something I'll never forget. "I feel young again because I finally understand my body." And then there are those who spent years relying on pain pills because nothing made sense. Once they learned how to read their symptoms, when to use heat and when to use cold, and how to support their joints daily, the pills slowly lost their hold on them. These transformations are not rare. They happen when seniors stop fighting their bodies and begin listening to them. And now that we've explored what is possible when heat and cold are used wisely, it's time to talk about how to stay safe along the way. Safety guidelines for seniors. As we come to the final section of our main content, I want to shift the conversation to something just as important as using heat and cold correctly, using them safely. Temperature therapy is incredibly effective, but only when approached with awareness, patience, and respect for your body's limits. Over the years, I've seen many seniors experience setbacks not because their joints were failing, but because they unknowingly used heat or cold in ways that created new problems. And that's something I want to help you avoid. One of the most common issues I see is overuse. Many people assume that if 10 minutes of heat feels good, then 30 minutes might feel even better. But the body doesn't work that way. Whether you're using heat or cold, moderation is essential. Short, controlled sessions allow the tissues to respond without overwhelming them. 10 to 15 minutes is usually enough time for your joint to absorb the benefits. Anything longer increases the risk of irritation, swelling, or even burns and skin sensitivity. Another concern is applying heat or cold directly to the skin. Seniors often have thinner, more delicate skin, and placing a heating pad or an ice pack directly on the surface can cause more harm than good. I've seen patients accidentally burn themselves because they fell asleep with a heating pad or wrapped ice too tightly against their knee. A simple barrier, like a thin towel, creates just enough protection while still allowing the benefits to reach the joint safely. Alternating heat and cold can also be helpful, but only if you understand when to do it. For example, if you have stiffness in the morning and swelling in the afternoon, you might use heat first to get moving, then cold later to calm the inflammation. But alternating should never be random. It should follow the body's signals. Using heat on warmth, redness, or puffiness will make things worse. Using cold on muscles that already feel tight will increase tension. Listening is the key. There are also times when temperature therapy should be avoided altogether. If you experience numbness, reduced sensation, open wounds, or certain circulatory issues, it's important to speak with a healthcare professional first. And if joint pain is accompanied by fever, sudden weakness, or severe swelling, that is your body signaling a deeper problem. These are moments when medical guidance is not just helpful but necessary. Despite these precautions, I want you to feel empowered, not afraid. When used correctly, heat and cold are among the safest and most natural tools for joint care. They give you control. They give you options. They allow you to respond to your body rather than tolerate discomfort in silence. Understanding these safety principles ensures that every step you take brings you closer to relief and not further away from it. And now that we've covered how your joints work, when to use heat, when to use cold, how lifestyle affects recovery, and how to stay safe, it's time to bring all these lessons together in a powerful, hopeful conclusion. Hope, strength, and healing through understanding. As we close our time together today, I want you to take a moment and breathe gently. Let your shoulders relax. Let your body settle. So often, seniors carry the weight of joint pain as if it were a sign of failure, something they must simply endure. But pain is not failure. Pain is communication. It is your body speaking to you, asking for attention, guidance, and care. When you begin to understand that message, your healing journey truly begins. Heat and cold therapy are not complicated treatments. They are simple, powerful tools that work with your body, not against it. When used correctly, they can bring relief faster and more safely than many medications. Even at 60, 70, or 80 years old, your joints and muscles respond beautifully to the right support. Your body is always listening, always adapting, always trying to help you move through life with as much comfort as possible. Small daily habits become the building blocks of long-term mobility. Heat when you feel stiff, cold when you feel swollen. Drink water throughout the day. Stretch gently. Walk a little more. Move even when you don't feel perfect. These are not grand changes, but they are powerful ones because they teach your body that it is supported, respected, and cared for. And above all, I want you to celebrate the body you live in. It has carried you through decades of memories, challenges, joys, and seasons of growth. It has healed you more times than you can count. And it still wants to heal. It still wants to move. It still wants to support you. Your independence is not protected by medication alone. It is preserved by knowledge, consistent action, and the belief that your body is worthy of care. If today's message helped you feel even a little more confident in understanding your pain, I invite you to stay with us. Follow Senior Health Daily for more guidance, hope, and practical steps to help you live with strength, clarity, and comfort every day. Your best years are not behind you. They are still ahead, waiting for you to step into them.